Welcome to my channel. My name is Dr. Bertha IE. Thank you for watching the 3 other videos I did on lupus. I'm raising awareness for lupus. I'm in purple today because purple has been designated sort of the color for lupus, and so on May 10th you're supposed to wear something purple like me and just do #lupus or #lupus awareness somewhere on social media. And so in the previous 3 videos, I have talked about how lupus occurs, the signs and symptoms, and in this video, I want to just briefly talk about the risk factors. And I'm hoping that you would realize that lupus patients are around you all the time. Ever since I started this series, I've had emails and WhatsApp messages. This one says my wife had lupus, my sister had lupus, my daughter had it, and it's all around us, but we don't see, because once the diagnosis is made, they start taking medication. It's their personal battle. My hope is that their battle will become your battle too, and that you would help them fight it and support them. So we're going to talk about risk factors, the management, and what lupus patients can do to support themselves. And so I'm going to show you this graph that shows you the points of prevention. There are 50% genetic risk factors we can't do anything about, or maybe we can, we don't know yet. Then the environmental exposures. If we could identify a food, medications, things that can trigger lupus, we would avoid them, right? One area that has been shown, studied is that black women who put chemicals in their hair can have elevated estrogen levels. That is well established. It's been well established in the sister trial, where the NIH is looking at 50,000 women who are siblings of breast cancer patients. The risk of uterine cancer was 4 times in those who put chemicals in their hair. And people have studied lupus patients who don't treat their hair and those who treat it. So we know that's a risk factor. Please go natural like me. I've permed my hair for years. And then a few years ago, maybe sometime about 14 years ago, I thought, you know what? I don't want to put a chemical in my hair. And my hairdresser would say, oh, it's hard to manage. You can't do anything about it. Let's just keep perming. And then one day in 2014, I'm like, let's cut this. I went through several reiterations till I discovered sister locks. Do you have to go do sister locks? No, but I'm telling you, go natural. It might save you a lot of heartache. So let's go along the graph. If you can't stop the exposure, now what can we do to identify people who are high risk? If you are a sibling or a first-degree relative of somebody who has lupus, you probably have antibodies. It doesn't mean you will get sick though, but it's good to identify siblings and other people who are high risk. It's also been shown that for the men who have lupus, about 1/3 of them will have Klinefelter syndrome, where their chromosome is actually XXY. And so these are all people who are high risk for developing lupus. And then they've talked about sunshine. We can't really avoid sun exposure, but all these are possible factors, and there's a lot of research going on. The next thing we'll talk about is this preclinical phase. There's a trial going on where they're looking to see if you give hydroxychloroquine to somebody who has only one body system involved and a positive antibody, whether you can prevent the disease. I think it should be a no-brainer. Why would you want to wait till 4 of my organ systems are involved before you put me on medication? I don't want to be on dialysis, and so I'm just talking for the lupus patients. So somebody has lupus, what happens? Oh, and then finally there's the organ damage, where at that point the goal is to minimize the damage and minimize the tissue damage, basically. So somebody has lupus now, yeah, they have kidney failure, they have a skin rash, they're getting pericardial effusions causing possible tamponade. What can people do? So first of all, the bone and joint disease can be managed with what we call non-steroidal anti-inflammatory agents. Ibuprofen, indomethacin, a few of those can reduce the pain. They don't stop the disease. To manage the disease, which is all these abnormal cells which have formed immune complexes, you can be given steroids or hydroxychloroquine or Plaquenil. This drug became quite common in the COVID era. Other medications that can be used include methotrexate or azathioprine. Sometimes they can use more immunosuppressive agents like mycophenolate mofetil. And your physician may combine all these things to get to a level where the disease is suppressed. Unfortunately, some people can end up with cirrhosis of the liver, requiring a transplant, and more commonly, kidney failure, where they either go on dialysis or require a kidney transplant. Also, if you have lupus or someone has lupus, don't keep the disease to yourself. It's no fault of yours. Find support. Join a support group. Or talk to your friends and family about it. That way they can be empathetic on the days you feel weak. And I forgot to mention the lupus headache. There's nothing unique about it. Patients with lupus can get headaches, period. The same immune complexes going around the body. So seek support. There's hope in lupus. Most of the patients who have lupus after the diagnosis live normal lives once they're taking their medication. Lupus can also have what we call flares and remissions. People would be fine one day, they don't take their medicine, they get their rash back. People with lupus don't present the same way. The fact that somebody had kidney failure and died within 3 to 4 years does not mean that everybody's going to behave that way. There are patients who have lupus with mild illness for many years, controlled with Plaquenil for many years. And so the disease fluctuates and everybody's different. The key take-home messages I've tried to teach you in going through this series: 1, something happened to these nice looking cells to turn them into abnormal cells. The abnormal cells got attacked by these blue antibodies, and they attack your red cells, they attack platelets, they attack white cells, leading to anemia. And as they attack tissues, it leads to symptoms including headache, dry eyes, and so forth. Talking about dry eyes, there's one thing I forgot to mention. Your body has these glands, parotid, submental, and submandibular glands, which I want to show you. Your submental glands are sitting right here, and we'll find the submandibular glands. Anyway, you have salivary glands that produce saliva, and you also have lacrimal glands that produce tears. In certain patients with lupus, all these things can dry up, leading to dry mouth. Now, we have an isolated condition called Sjogren's syndrome, where it's only the dry mouth and dry eyes. And tennis player Venus Williams has Sjogren's syndrome, just something that would help you remember. But that can be part of lupus. So in summary, I've shown you the reason why lupus occurs. We talked about risk factors, and we've talked about diagnosis. That it starts with a test. On your screen, I'm going to show you some of the tests that can be done to diagnose lupus. And then when these tests are positive, your doctor may do a complete blood count as shown on your screen to look for anemia and the hemolytic or the breaking down of the cells. Your doctor can check your urine for protein. They can check a complete metabolic panel looking for kidney abnormality or liver abnormality, and these are all tests that can be done. If you have fluid on your lungs or fluid in your abdomen, your doctor may get a CT scan or an ultrasound. This concludes the series on lupus. I hope you have learned a lot. We've talked about risk factors, signs and symptoms, testing, and by all means, support somebody with lupus. This month is Lupus Awareness Month. I wore purple for a reason, so that I'm supporting patients with lupus. Wear something purple, post it on social media. And my YouTube channel is youtube.com/@Adwoaserwa. Adwoaserwa is spelled ADWOASERWA. Follow me on Twitter. Subscribe to my channel. Share it with somebody. Share it with somebody you love. Lupus is around us, but we just don't even see it. Be compassionate, be empathetic, and if you're a lupus patient, know that there is hope. We have a God who heals all diseases. Thank you for watching, and subscribe for more educational content. This has been Dr. Bertha Sewa Ayi. Have a wonderful day.